As I stand before you today, we have more than 100 coronavirus cases in the United States. That is counting domestic cases and cases of coronavirus of Americans that were returned from China or the Diamond Princess. I'm pleased to report that most of those who contracted coronavirus within our care are continuing to recover. But sadly, we received word today that another American has passed away, and their family has our deepest condolences. The Center for Medicaid and Medicare Services has issued new guidelines for nursing homes. To be clear, if you are a healthy American, the risk of contracting the coronavirus remains low. But it is still a good idea to engage in common sense practices that are always recommended this time of year. To engage in common sense practices that it's a good idea to stay home when you're sick. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Cover your cough or sneeze with tissue. Throw the tissue in the trash. Clean and disinfect frequently. Wash your hands with either a disinfectant or with soap and water for at least 20 seconds. And let me say again, as we've said before, there's no need for Americans to buy masks. The common sense practices that I just described are all available at cdc.gov. The federal government in full partnership with state and local health authorities to make that. And we were pleased to learn that just shortly ago, the House of Representatives passed a federal funding bill by a virtually unanimous margin. It'll now move to the Senate. And the legislation implements the President's vision to ensure that not only do our federal agencies have the support and resources that they need, but also that our state and local partners have their support. And in my conversations with governors all the way through this afternoon, I know they're grateful for the bipartisan spirit that has characterized this funding bill, and we'll continue to work through that process. Those who are in nursing homes, people operating the nursing homes, like many of the CEOs that we met with today, it does appear that the elderly are the most vulnerable, and especially those with serious health issues. At the President's direction, as a result, Seema Verma will describe that the Center for Medicaid and Medicare Services has issued new guidelines for nursing homes nationwide. We have raised the bar regarding infectious disease control at our nursing homes. And in addition, Administrator Verma will explain how we are going to focus all of our inspection resources for the foreseeable future on compliance with infection control standards. We've got hospitals in affected areas and those that are requesting that have kits. We've got universities and state labs that now can perform the test on a requested basis. But our objective ultimately, and as quickly as possible, is to have tests made through these commercial laboratories and commercial providers that your local doctor, your CVS, your MedCheck is able to have a coronavirus test. And that isn't there yet. We're working to make that a reality.